Thank you so much for joining me. I'm so excited today because I'm joined by Dr. Amrita Singh, and this beautiful, wonderful, amazing, talented woman is just one of the best homeopaths you could ever wish to meet. We've just been chatting before jumping online with you, and I'm so excited to introduce her to you. So, Amrita, thank you so much for coming along today for your CMA Showcase video. Welcome. It's so nice to have you.
Thank you. I was looking forward to it from so many days. Yeah,
Yes, I know. I know. We had to keep rearranging, and that's mainly my fault because of all
no
sorts
worries.
of technical things. But Amrita, thank you. So I sort of feel a bit casual calling you Amrita, but it's such a beautiful
No
name.
worries.
I love
Oh,
it. But more formally, you're Dr. Singh. So would you like to tell the audience about the work that you do?
okay. So it's a long story that I would like to share with the audience, but to get it short, because nobody likes to hear a story basically. So I started as a homeopathic patient and not a very perfect beginning of my professional journey. Getting into nutrition, being a consultant, being the head of the department, then getting back into psychology studies in the UK from India to UK. And then finally, the long lost calling, homeopathy held my hand, and now I am a psychologist, homeopath, and a clinical nutritionist, of course, registered in the UK.
Yeah.
So basically, when we practice in India, it is, patients seek everything. The doctors are the second god to the patients, and the teachers are, of course, as you are to me. So, so it is not a saying. We truly believe that they are the second god after mother, obviously. So yes, so when a patient come to us, the first thing we do is counseling. Apart from giving any medications or anything, home remedies play a very important role. Before coming to a doctor, the mother and the grandmothers give a clove for bleeding gums, and ginger shots for cough, before even getting involved into all the complex functional medicine and anything. So then they come to us, and then we counsel them. It is all going to be okay. You are perfectly fine. You are in the safe hands, and all that stuff. And then, according to the patient demand, that I just need nutrition advice, or I just need counseling, or I just need to be, you know, I just need everything. You have to tell me what I should eat, what I should do, what I should think, and of course, medicine. So basically, in my clinical experience, I saw doctors giving like everything. Even the surgeons who are just surgeons, they give counseling and they give home remedies advice. It is in our culture, it is embedded in our culture. When I came to the West, it is just about medicine. If you're coming to me, you tell me the symptoms, I study about it, and then I prescribe blah blah blah. So my approach is that I will carry on that warmth that I bring from my country, India, basically, the how we practice. Obviously, clinical approach is the best thing that we still need to develop in India. But that warmth, I think, is missing here. We need to, a patient should, when he comes to you, whether physically or on a video call, he should feel a safe space, that it is confidential. She or he will not, spit it out anything about me in audience or to any doctor itself. It is very confidential thing, because obviously, if you are suffering from something, it is a drawback. It is something shuts down your confidence in some sort of way. So yes, my approach is that if a person comes to me, first of all, he should feel secure like he feels with his mother. So, yeah, that's all I do.
That's fantastic. That's all you do. Oh my goodness me. No, it's absolutely extraordinary. I mean, and your whole career, your whole background is just absolutely incredible. I remember reading on, I think on your site, and you're saying that you were you led 1,000 bed unit. Is
Mm,
that right? I mean,
yeah, yeah, super specialty hospital, yes.
It's absolutely extraordinary. You're just you're a gift to us here in the UK, quite honestly. It's absolutely amazing. Do you have, so you work as a homeopath, working with nutrition and psychology. So you're a very rounded practitioner. So is there anything in particular that you specialize in? And I appreciate that's a difficult question for somebody who's predominantly working holistically as a homeopath or what have you, because of course we take a case and we work with the individual patient, and we're treating the individual, the person's the totality of their individual symptoms. So everything we do is completely super customized. But is there any particular type of illness or pathology that you tend to gravitate towards, or you find yourself treating more so than not?
Okay, so I think cough and colds, basically all that flus and fevers come gifted to me because I was myself a patient when I was a neonate. So that is instinctive, very instinctive, because I have seen my doctor treating me and I have been his patient now for 26 years.
Mm.
And obviously he would have trained me in a certain way. He's just like a family doctor, so I would pop in anytime, and he when he was treating the patient, I was like, okay, he's asking that, he's asking that, he's asking that, but never a clear path. I never got a clear path what I need to do.
Mm.
So that is a complex question of me to answer, that what I specialize in and particular diseases. Okay, I in my clinical experience now of 5 years, I have seen every type of condition and disease.
Mm.
In India, basically, we are eligible to, prescribe tests and other type of things. Here we cannot. It's fine. How
Yes,
the country works, it is perfect.
yes.
So, anyways, I specialize in any type of disease. I don't think so.
Mm.
You know, it's just a gift that if somebody comes to me with a condition and I studied. I give the medications. Till now in the UK, I have seen 18 cases. I jot down every case and every follow up and every medication. It's my habit of writing it down.
Yes.
So they have been benefited. So I'm not praising myself. That's God gifted. Touch wood. So yeah, basically, being a depressed kind of person myself, because I could not find homeopathy in my early years, though I'm not very old, but it's fine. So I will say that I specialize in depressions and these kind of things, because a person is disabled, but he won't physically look. He can be highly functional, depressive person.
Yes.
A smiling face can be a depressed person. So I think that's my specialty. I would say that.
Yes. That is fascinating. And I think it's really interesting. For those of us in complementary medicine, we understand the concept of holism. So it means that, we understand that, yes, you're going to see a homeopath who will give you a homeopathic remedy, usually for those who don't know about homeopathy, usually a tablet. And so I think a lot of people will think, gosh, how can that possibly treat depression? Don't you need antidepressants and so on, without necessarily understanding about the way that homeopathy is an energetic system of medicine. And the one little tablet contains the energetic blueprint of what your body needs in order to get itself back to a state of balance or homeostasis. And I remember myself, the first time I was given a homeopathic remedy, I had really, really bad flu, and it's a long story, and I'll keep it very short. But I don't know if you've had similar patients this, because I came to homeopathy quite late in life. You had the blessing of coming to it very early in your life. But I remember I sent my then boyfriend, because I had this bad flu. I sent my then boyfriend down to the pharmacy, and he came back with this bottle, and it had one tablet in it. I said, but I'm ill. I need drugs. And he said, oh, yeah, well, the pharmacist, he's this student. He does homey something. And oh, well, it's the only thing I've got here. I might as well take it. And of course, to my absolute shame and horror and disgust, I took this tablet. I went to sleep for an hour and I woke up and the flu had gone. Um, and I was rather intrigued, shall we say. So I went to have a conversation with this pharmacist. What's that witchcraft you did to me? And he said, no, it's homeopathy. He gave me a book. And then, of course, I was just completely transfixed by this whole thing. And I think people don't realize that the power of homeopathic medicine, and it really does work on the individual rather than, just being good for a bad back or just being good for treating coughs and colds or just being good for menstrual cramps or what have you. It is so all-encompassing. And the other thing I wanted to ask you about was that you've got your wonderful clinic. And when I was looking at your fantastic website, you've got lots and lots of different homeopaths that you work with. Are they just homeopaths, all of your colleagues, or do they also do other things as well?
Oh no, I think most of them has transformed into homeopath later in life. Many of them were midwives or the vets, and because homeopathy is a complete miracle, I want to know, you people, you should know it's a complete miracle, and I am not into any medicine now. If I have a headache or eyesight or whatever, I just completely trust homeopathy. It's gentle but miraculous if
Mm.
not effective then,
Yeah.
because it doesn't have any side effect. You just take it, it will work. If it will work, it won't work otherwise.
Yes. Yes.
So there are many professions of my colleagues. I don't know all of them, but some are midwives and some are vets out there, and some are BHMS from India, homeopaths, yes.
Yeah. Yeah.
And then there is me. I don't know
Oh,
anyone.
oh, well, you're just absolutely amazing. So how do you see your patients? I mean, do they have to actually come to visit you? And if so, where are you based? Or do you also see people online? How do you work?
Okay. After coming to UK, obviously it is everything is based online. But if a patient in my shift asks for a home visit, then absolutely. If even if it's 3 hours or 4 hours away, I give him the home visit.
Oh,
I have given only one person home visit till now. She was based in Ashley, I think, if I
right.
am pronouncing it right.
Yeah.
So it was 2 hours from me, one way. So my belief is that practitioner should know no boundaries. Okay, but if a patient is coming to you, he is putting his trust into you, and even if it is away. But in our culture, it is the thing that for the very first time a patient should physically visit you, because of course, rather than the words, it is a face that you put your trust in. It is a psychological thing. You need to see the face of a person when you are talking to someone, and when it is a medical advice, you need to see his face.
Mm,
So I cannot do it here in the UK,
mm,
but I'm planning to go back to India very time soon.
mm.
And then I am planning to give my virtual clinic a physical presence there. And of course, the home visits, and why not online thing? I'll keep continuing with that.
Yes, yes, that is fantastic. So, if somebody would like to have a consultation with you, would you be able to do? Let's say if you were back in India and somebody from the UK wanted to have a consultation with you, would you consider taking them on as a patient, even though you hadn't been able to meet them face to face in the real world in the flesh?
Yes, why not? If he wants me, if I can help him, if
Right.
the disease or condition is in my hand, at least I will try. And
Yes.
it is
Yes.
a gift, of course, that in our culture it is said that हाथ में शिफा होती है. I know you won't understand that. It is a very Indian and Hindi and Urdu thing, but it is said that he has a gift of healing a person. That is called हाथ में शिफा.
Yeah.
So I think I have that.
Yes.
God gifted, not praising myself, sorry, no offense. But yes, if a person is coming from UK, USA, Canada, Australia, New Zealand, even from Mars, I am treating him. Why
The Martian patients are queuing up right now. No,
not?
this is absolutely fantastic. Really, really superb. And if somebody was able to come and see you in your clinic in the UK, whereabouts are you based?
Oh, I practice online in the UK. I can give home visit because I don't have a home here and I
Uh-huh.
am myself on rent, so there's no physical
Right.
presence to it right
Oh,
now.
okay. So you
Yeah.
will go out. That's amazing. I mean, just getting a home visit, what a privilege. What a luck, what an absolute privilege for somebody to come to see, for you to be able to go to see somebody, I should say. I mean, that is really remarkable. And not many people work like that nowadays. It's very, very valuable. And I think that anybody that, was able to be treated by you is very lucky and very privileged indeed. So no, thank you for the work that you do. You are quite an amazing lady, and I really do. I really look forward to you doing more with the CMA, perhaps some tutorials for us and so on, because you're a very special soul, and we're very, very lucky and very privileged to have you as a member. So I just want to thank you from the bottom of our hearts, and
Grateful.
know that our viewers and listeners will be so thrilled to meet you, and we look forward very much to having you back and seeing what else you can teach us about. But thank you, so much. It's such a privilege, and we will see you soon, no doubt.
Okay, thank you so much. I'm so grateful.
Pleasure.